Have you ever thought about what you would do if you suddenly had a heart attack and you were completely alone? It's not something most of us want to think about, especially when we get older. We prefer to imagine our lives as full of warmth, companionship, and good health. But the truth is, heart attacks don't give us a warning. They can strike without any notice. And for many seniors, especially those who live alone, this could be a terrifying reality. The question isn't just about whether it could happen to you. It's about what you would do if it did. I want you to imagine something for a moment. You're sitting in your favorite chair, reading a book, or perhaps relaxing in your living room, enjoying the calm of the evening. Then, suddenly, something doesn't feel right. Maybe you feel a tightness in your chest, or your breathing gets shallow, or even your arm starts to ache. It's easy to ignore these signs. After all, who wants to believe something so serious is happening? But deep down, you know it's not just indigestion or a passing ache. Your heart is trying to tell you something. Now, if you're under 60, you might have someone close by, a spouse, a neighbor, a friend, to help. You could rush to the hospital, call someone for assistance, or even get medical help on the way. But when you're over 60, especially if you live alone, the situation is different. The reality is, many seniors find themselves facing medical emergencies without anyone nearby to help. That's why I'm here today, to talk about how you can survive a heart attack if you find yourself alone after 60. You don't have to be afraid of what you don't know. With the right knowledge, you can be prepared, stay calm, and take action, all of which are crucial to giving yourself the best chance of survival. Now, before we dive into the 7 life-saving tips that could help you in the event of a heart attack, let me tell you one important thing. You are stronger than you think. There's a unique strength that comes with the wisdom of age. You've already lived through challenges, faced difficulties, and overcome obstacles. A heart attack may seem like a terrifying ordeal, but with the right mindset and knowledge, you can face it head-on with confidence. In this video, I'm going to share the essential steps you need to take to survive a heart attack alone. These aren't just random tips. They are practical, life-saving actions that have been backed by medical professionals and are proven to make a difference. These tips aren't about scaring you or making you feel helpless. They are about empowering you. I want you to know that in the face of a heart attack, you can take control and make choices that might just save your life. Heart attacks can happen to anyone, regardless of how healthy you feel or how many precautions you've taken. But when you're prepared, you'll have the tools and the peace of mind to act quickly and wisely. You won't be left standing there wondering what to do. Instead, you'll know exactly how to respond and, most importantly, how to stay calm. I know this might seem daunting, and I won't sugarcoat it. Heart attacks are serious. But I also want to remind you of this. You have the power to make decisions in the face of uncertainty. You can turn fear into action. This video isn't just a guide for surviving a medical emergency. It's a guide for empowering yourself to be your own advocate, even when help seems far away. So, let's talk about those 7 life-saving tips. Tips that every senior should know, because you never know when the situation might arise. Let's give you the confidence, knowledge, and strength to face a heart attack, should it ever happen. Together, we'll ensure that you know exactly what to do, and more importantly, that you are never alone in this journey. Remember, you've lived a long life filled with wisdom and experience. And with this knowledge, you can add one more important chapter to your story, one where you face the unexpected and come out victorious. So, let's dive in and learn how to stay safe and survive no matter what. Part 1. Recognizing the signs. Don't ignore the warning. Now, before you can act, it's essential that you first recognize the signs of a heart attack. This is a critical first step because when your heart begins to act up, it sends out signals, warning signs that shouldn't be ignored. But here's the thing, not all heart attacks look the same. In movies or on TV shows, we often see people clutching their chest in agony and collapsing to the ground. While that can happen, it's not always the case. For many people, particularly older adults, heart attack symptoms can be more subtle. They might appear as simple discomfort, something you could easily brush off. That's why it's so important to listen to your body and be aware of the signs, even the ones that might seem small or insignificant at first. A heart attack often begins with chest pain or discomfort. It may feel like a heavy pressure or tightness, as though something is squeezing your chest. For some, it's a sharp, stabbing pain, but for others, it might feel more like indigestion or gas. If you experience this feeling, don't just dismiss it as something you ate. Pay attention. Is it getting worse? Does it last more than a few minutes? That could be your body telling you that something is wrong. But chest pain isn't always the first or the only symptom. Heart attacks can also cause shortness of breath, dizziness, or even nausea. Some people might feel like they can't catch their breath, or they might start to sweat excessively, even if the temperature around them is normal. These symptoms can sometimes mimic other health issues like anxiety or exhaustion, so it's easy to overlook them. But if you start to feel lightheaded or disoriented, it's time to pay attention. Your body is telling you something important. Another symptom that might surprise you is pain in other areas of your body. Some people feel pain radiating down one or both arms, typically the left arm, but not always. It's a strange sensation, like a dull ache that won't go away. The pain can also spread to your back, shoulders, jaw, or even your stomach. These aren't random aches. They could be signs that your heart is in distress. If you feel these sensations, especially when combined with other symptoms, don't ignore them. Your body is trying to communicate with you, and it's important that you listen. The key takeaway here is that heart attack symptoms aren't always dramatic, and they don't always follow the textbook definition. They can be subtle, and sometimes they are easily mistaken for something else. So, if you feel something unusual, don't just brush it off. Trust your instincts. Even if the discomfort seems minor, it's better to be safe than sorry. Call for help and seek medical advice. Remember, the quicker you act, the better your chances. Part 2. Call for help. Don't hesitate to reach out. Once you've recognized that something's wrong, the next critical step is to call for help. And don't wait. Every minute counts in the event of a heart attack. The faster you get medical attention, the more likely you are to survive and recover without long-term damage. But here's where the situation can get tricky. If you're alone, how do you reach out for help? In today's world, we're fortunate to have many ways to call for assistance. If you're able to get to your phone, don't hesitate to dial emergency services immediately. In most places, this is 911, but it may be different depending on where you live. You don't need to second-guess your symptoms or wait to see if they get worse. Call for help right away. When you call, make sure to explain clearly what's happening. Let the operator know that you suspect you're having a heart attack. They may be able to provide immediate advice over the phone, and they will send help your way faster. But what if you're unable to get to your phone? This is where a little foresight and preparation can make all the difference. There are several ways you can ensure help will still reach you. If you have a medical alert system or a smartwatch with emergency features, these can be lifesavers. Many of these devices are equipped with fall detection, GPS tracking, and one-touch emergency buttons that alert medical services or a loved one. These devices are designed to be simple to use, even in stressful situations, so make sure you have one within reach at all times. If you don't have a device like that, don't panic. There are still other ways to reach out. If you have a landline phone within arm's reach, use it. If you have a neighbor, family member, or close friend who lives nearby, try to get to a window or door where you can shout for help or signal them. If you're unable to speak, try texting someone to let them know what's happening. It's a good idea to have your emergency contacts saved in your phone for quick access. The key is to act quickly. Don't wait for the pain or symptoms to get worse. Another important thing to remember is that you should never try to drive yourself to the hospital if you're alone and suspect you're having a heart attack. Driving in that state can be dangerous, and you could end up making the situation worse. Wait for medical help to arrive. Paramedics and emergency responders are trained to stabilize you and get you to the hospital safely, which is much more effective than attempting to make the journey on your own. It's natural to feel scared or unsure in moments like these, but the most important thing you can do is stay calm and focused. Don't try to tough it out or second-guess yourself. If you think you're having a heart attack, get help immediately. You'll never regret acting quickly, but you might regret waiting too long. Part 3. Stay calm. The power of a clear mind. When a heart attack strikes, panic is one of the most natural reactions. Your body starts to go into fight or flight mode. Your heart races and 1,000 thoughts rush through your mind. It's overwhelming. But here's something you need to remember. Panic is your enemy. It can make everything worse. It can cloud your thinking and prevent you from acting rationally. Staying calm in the face of an emergency is one of the most powerful tools you have. It may sound easier said than done, but believe me, with a clear mind, you can make better decisions and increase your chances of survival. First, take a moment to breathe. I know it might seem hard when you're feeling the tightness in your chest or the sharp pain, but your breath is a lifeline. The act of deep, controlled breathing has the ability to calm your nervous system, slow down your heart rate, and ease the tension in your body. Focus on taking slow, deep breaths. Inhale through your nose for a count of 4, hold for a second, and exhale slowly through your mouth. Do this a few times. As you focus on your breath, you will start to feel your mind and body relax, just enough to regain control over the situation. Breathing deeply doesn't just calm you, it also helps oxygenate your blood, which is critical during a heart attack. When your heart is struggling, it may not be able to pump blood efficiently. Taking slow breaths helps ensure your body gets enough oxygen to keep your organs working as best as they can while you wait for medical help to arrive. Also, if you start feeling lightheaded or dizzy, sitting down and leaning against something can prevent you from falling. If you're in a position where you feel like you're going to faint, lying down with your head slightly elevated might help. This simple action can assist in improving blood flow to your brain, which is crucial in preventing further complications. Keep in mind that panic will only make your heart work harder, and when you're in the middle of a heart attack, you want to conserve your energy. The calmer you stay, the less strain you're putting on your heart. Try to avoid any movement, as activity can increase the demand for oxygen, which your heart is already struggling to provide. If you're on the phone with emergency services, focus on speaking calmly. Give them all the necessary information, but don't rush through it. A steady, clear voice will help them assess the situation better, and they may even be able to guide you with additional advice on managing the symptoms until help arrives. Remember, the mind is powerful. In moments like these, your ability to stay calm can truly make a difference. If you can manage your fear, you'll be in a much better position to act wisely. Part 4. Chew aspirin, a simple step that could save your life. When you realize you're having a heart attack, every second matters. One of the simplest and most effective actions you can take to buy yourself more time is to chew aspirin. It's one of the first things doctors recommend in the event of a suspected heart attack. But let me be clear, this is not something you should do once you're already in the hospital. This is something you can do immediately, right in the moment. Aspirin works by thinning the blood, which can help reduce the damage caused by a blocked artery, the primary cause of most heart attacks. When a heart attack occurs, it's typically because a blockage in one of your coronary arteries prevents blood from flowing properly to the heart muscle. This lack of oxygen-rich blood causes part of your heart muscle to start dying, which can lead to long-term heart damage or even death. The sooner the blood flow can be restored, the less damage is done. If you have aspirin nearby, take a chewable aspirin and chew it slowly. Do not swallow it whole. By chewing the aspirin, you're allowing it to enter your bloodstream more quickly, which means it starts working immediately. Aim for a dose of about 325 milligrams, which is the standard recommended amount for adults during a suspected heart attack. If you're unsure of the exact amount or have a different type of aspirin, don't worry. It's better to take some than none at all. However, there are some important considerations before you reach for the aspirin bottle. If you're allergic to aspirin or have been advised by your doctor to avoid it for other medical reasons, don't take it. It's essential to know your own medical history and any conditions that may contraindicate aspirin use. For example, People who have a history of bleeding disorders, ulcers, or certain types of gastrointestinal issues should not take aspirin unless a doctor specifically says it's safe. If in doubt, or if you're unsure, don't take aspirin. But if you're in the clear, chewing it can be a life-saving move. Aspirin is a simple, inexpensive tool that can help buy you time, but it's no substitute for professional medical treatment. It doesn't reverse the damage of a heart attack, but it can help slow it down and minimize the harm while you wait for help to arrive. It's one of the few things you can do on your own to increase your chances of survival, a small, accessible step that could make all the difference. If you don't have aspirin with you, don't panic. There are still other things you can do. But if you do have aspirin, take it. It's a small action that can make a significant impact, especially in those critical moments when every second counts. Part 5. Monitor your breathing and pulse. Stay connected to your body. Once you've recognized that something is wrong, called for help, and taken steps to stay calm, the next thing to focus on is monitoring your body. While waiting for emergency services to arrive, it's essential to keep track of your vital signs, specifically your breathing and pulse. This helps you understand what's happening to your body and can give you valuable information to relay to medical professionals when they arrive. Start by focusing on your breathing. If you're struggling to breathe or feeling short of breath, it's important to recognize that this is a common symptom during a heart attack. The heart is no longer pumping effectively, and your body may not be getting the oxygen it needs. If you notice that you're gasping for air, or if your breaths are shallow and rapid, it's essential that you try to stay as still as possible to reduce further strain. Don't try to move around to look for help. You need to conserve energy. Continue with your deep breathing exercises, inhaling through your nose and exhaling slowly through your mouth. The more calmly you breathe, the better your chances of maintaining the oxygen levels your body needs to function. As you focus on your breathing, it's also crucial to keep an eye on your pulse. Your pulse is an indicator of how your heart is functioning. If your pulse feels weak or irregular, it's another sign that your heart is struggling. You can easily check your pulse by placing 2 fingers, either your index and middle finger, on the inside of your wrist, just below the base of your thumb. Apply gentle pressure until you feel the heartbeat. Count the beats for 30 seconds and then multiply that number by 2 to get your heart rate per minute. A normal resting heart rate for most people is between 60 and 100 beats per minute. If your pulse is significantly faster or slower than usual, or if it feels erratic or fluttering, it's an indication that your heart is under distress. If you notice any of these irregularities, don't panic. Continue focusing on your breathing, stay calm, and ensure that you're still in a safe position. Keep monitoring your pulse and breathing until medical help arrives, and let them know the condition of your heart rate when they get there. The more details you can provide, the better equipped they'll be to treat you effectively. Another important aspect of monitoring your pulse and breathing is recognizing any changes in your overall physical state. If you start feeling even more dizzy or lightheaded, or if your pulse starts becoming harder to detect, it's an urgent signal that your body may be losing function. Again, this is why staying as still as possible and taking deep breaths is so crucial. Your goal is to avoid overwhelming your system, allowing you to keep a steady stream of oxygen circulating until you're able to get the medical care you need. Remember, your body is telling you what's going on, and paying attention to these signs is vital. By staying connected to your body and being aware of your pulse and breathing, you will be in a better position to provide valuable information to first responders and help yourself stay as stable as possible until help arrives. Part 6. If you're alone, don't try to walk, rest, and conserve energy. If there's one thing you should take away from this section, it's this. Don't try to walk around during a heart attack, no matter how much you feel like you need to do something. I know it can be instinctive to want to move around, to try to get to the phone or to help yourself in some way. But moving during a heart attack can worsen your condition. Your heart is already under a tremendous amount of strain. The more you move, the more oxygen your body needs, and your heart may not be able to supply enough blood to sustain that demand. If you're alone, the best thing you can do is remain still. Find a place where you can sit or lie down comfortably, preferably with your upper body elevated slightly. This position makes it easier for your heart to pump blood and can help reduce the strain on your cardiovascular system. If you're sitting, lean back against something sturdy, or if you're lying down, prop up your head with a pillow or cushion. This posture helps your body relax, keeps your heart from working too hard, and promotes better circulation. If you're feeling dizzy or lightheaded, it's even more important to stay still. In fact, if you feel like you might faint, lying down completely, with your legs elevated, can help. This position can help prevent a drop in blood pressure, which can cause you to faint. Keeping your feet above the level of your heart allows gravity to assist the flow of blood back to your brain, making you less likely to lose consciousness. In these moments, your focus should be on making sure that you are as relaxed as possible, with your body in the most restful position. I know it's frustrating to feel so helpless in such a critical situation, but moving around or walking during a heart attack puts more strain on your heart and raises the risk of complications. If you're trying to move to another room to reach a phone or get help, stop. The time it takes to move can make the situation worse. Instead, prioritize rest. The sooner you rest, the quicker you can start stabilizing your condition. And don't worry about looking weak or being embarrassed if you have to sit down. You're not giving up by staying still. You're helping yourself. Moving, whether it's trying to stand up or walking around, puts unnecessary pressure on your heart and could ultimately make the heart attack more severe. Let your body rest, conserve energy, and give your heart a chance to recover while you wait for help. Remember, while you may feel alone during a heart attack, your goal is to stay as calm and still as possible. The calmer you remain, the better your chances of surviving this. And though you may not have someone by your side right now, rest assured that your body knows what it needs to do. Your heart knows how to heal, and you are doing the right thing by giving it the time it needs. Part 7. Preparing for the worst. What to do if you're losing consciousness. As much as we hope for the best, sometimes things take a turn for the worse. While your goal is always to stay calm and stay conscious, it's important to prepare yourself mentally for the possibility that you might lose consciousness during a heart attack. If that happens, knowing what to do, or what to expect, can help you remain as composed as possible, even in the face of such a scary situation. Losing consciousness during a heart attack can be the result of many factors. When your heart struggles to pump effectively, your blood pressure may drop, causing dizziness or fainting. This is why it's so important to listen to your body and take steps to manage the situation before it gets worse. If you feel yourself becoming faint or lightheaded, try not to panic. Again, lying down with your head elevated is key. If you can, place your feet above the level of your heart. This helps blood circulate better and reduces the chance of fainting. If you're able to, it might help to place something soft or padded under your head in case you fall unconscious. If you do lose consciousness, it's critical that you've already called for help. One of the first things paramedics will do is assess your level of responsiveness. If you're unable to respond, they will begin providing life-saving interventions like CPR or other treatments to stabilize your heart. However, this is why early intervention is so important. The sooner emergency services are on the way, the better your chances of receiving timely and effective care. At this stage, there's not much you can do for yourself if you lose consciousness. But you can prepare by ensuring your emergency contacts are aware of your health conditions, including any heart problems or medications you're taking. If you have a medical alert system, make sure it's activated, and if not, see if you can access a phone to call someone. Also, if you feel like you're losing consciousness, try to stay as still as possible and keep your body in the position that promotes blood flow to the brain. Sometimes, the most important thing you can do in these situations is to keep your mind calm and accept that there is a limit to what you can control. But it's crucial to remember that you've done everything right up to this point. You've called for help, stayed calm, and provided your body with the time it needs to stabilize. You are not alone in this. Conclusion: empowerment over fear. Preparing for a heart attack before it happens. Surviving a heart attack alone is a daunting thought, and I can't pretend that it's easy. But what I want you to take away from this video is that it's not just about surviving the moment. It's about empowering yourself with the knowledge that can give you the strength to act. The fear and uncertainty that come with a heart attack are real, but so is the wisdom and courage you already possess. With the right preparation, awareness, and mindset, you can face this challenge head-on, even if you're alone. These 7 life-saving tips are simple, but they are critical. Recognizing the symptoms, calling for help immediately, staying calm, taking aspirin, monitoring your body, conserving energy, and preparing for the worst. These are the steps that give you the best shot at surviving a heart attack. You can't predict when a heart attack will strike, but you can make sure that if it does, you're ready to handle it. But survival isn't just about reacting in the moment. It's about prevention. It's about taking care of your heart long before a heart attack happens. Eat well, stay active, get regular checkups, and manage your stress. Build a network of support, whether it's family, friends, or neighbors, so that you're never truly alone when you need help. If you take nothing else away from this video, take this. You are stronger than you think. You've already lived through countless challenges, and you have the power to face this one as well. You can survive a heart attack alone. With the right mindset, quick actions, and calm preparation, you can emerge from this experience with a story of strength, courage, and resilience. Heart attacks may be unpredictable, but how you face them doesn't have to be. You've got this. Take these steps, trust in your body's ability to protect you, and never underestimate the power of your own wisdom and strength. You've already come so far. This is just another chapter in your remarkable journey. Stay strong, stay calm, and know that you are never truly alone.